Hello, my name is Anwen Metastasio, and I'm Head of Medicines Optimization here at NCH&C. And I'm going to share a presentation that I've prepared as part of Falls Awareness Week.
Hello, my name's Anwen Metastasio, and I'm Head of Medicines Optimization here at Norfolk Community Health and Care. As part of Falls Awareness Week, I'm going to be talking to you today about medication and their impact on the risk of falls. So before I start going into some specific information about medicines and how they increase the risk of falls, I thought I'd start with some facts. What is the number one reason for older people to be taken to the emergency department? Any guesses, considering that it's Falls Week? Absolutely. The number one reason for older people to be taken to the emergency department is actually falls, highlighting just how important it is that we do everything we can to help prevent falls from happening in the first place. So how many people over 65 years, out of 100, will fall at least once in a year? Now, this is the reported number, which I think means that this is probably an underestimate of the true number. So it's actually 30 people out of 100. So 30% of people over 65 years of age out of 100 will fall at least once in a year. And my final fact in this section is how about over 80 years of age? Any guesses out there? So it is actually 50 out of 100 people over the age of 80 that will fall at least once in a year. And as I mentioned, this is just the reported number of falls. So this is likely to be a huge underestimate of the true number. And this highlights just how important it is that we do everything we can to prevent falls. There are a lot of things to consider when someone has a fall, as well as the obvious pain and injury and the potential to break a bone. And I'll be talking about bone health and everything that you can do to help with that later on in my talk. But there's also the loss of confidence, and as a result, people can lose their independence because they're scared of doing the things that they've always done in case they have another fall. This can have a real impact on people's lives. The medicines that can increase your risk of falls are kind of divided into two different types. There's the ones that can affect your brain and the ones that affect your heart and circulation. So I've tried to summarize some of the more common medicines that can affect your brain and increase your risk of falls, although I've got some more specific examples later on. So there's the medicines that help you to sleep, and those that can help your mood and help you to keep calm. These medicines can make you sleepy and or confused. They can also slow your reaction time so that when you do lose your balance, you're less likely to be able to stop yourself from falling. There's also those that affect your blood pressure when you stand up from sitting or lying down. So that's something called postural hypotension. There's normally a drop in blood pressure when you go from sitting or lying down to standing up, but when it's a really big drop in blood pressure, that can make you feel a little bit dizzy and more likely to lose your balance. And then there's also antipsychotics can cause some movement disorders, so tremor and stiffness, and again that can increase your risk of falls. Then looking at medicines that affect your heart and circulation that can increase your risk of falls. They're the kind of medicines that lower your blood pressure and slow down your heart, and also stop you from building up too much fluid. And some of the ways that they increase your risk of falls is by causing dehydration, and that can also go hand in hand with some electrolyte imbalances, so things like sodium and potassium. They can cause you to need to rush for the toilet, and that can cause you to take less care if you're in a rush. And they can also lower your blood pressure too much. So it's important to make sure that the blood pressure is controlled really well, and important to review your blood pressure tablets regularly to make sure that they're still right for you. So here are some other ways that medicines can increase your risk of falls. They can affect your hearing and cause tinnitus. That can be really disorientating and affect your balance. It can cause your vision to blur. This is quite a rare side effect, but if it happens, it means that you might not see hazards in the same way or might misjudge some distances. And they can also lower your blood sugar too much, so that you have hypoglycemia or low blood glucose levels. In the same way as it's really important to monitor your blood pressure well, so that the right balance is found, it's the same with your blood sugar. We have to make sure that we lower your blood sugar enough to keep it within the right range without lowering it too much. So here I've summarized the medicines that act on your brain that are associated with a higher risk of falls. So the first group are sedatives. The two main classes of medicines in this group are benzodiazepines, which often end with PAM, so lorazepam, diazepam, nitrazepam, and then you've got chlordiazepam oxide in there as well, and the Z drugs, so zopiclone and zolpidem. They are usually prescribed to help people sleep, or if you suffer with anxiety, they can help with that as well. They are very good medicines to be used in the short term, but they don't work as well if you take them in the longer term. And there's a lot of evidence to demonstrate that they are associated with that increased risk of falls, because they can cause drowsiness. And with some of the more longer acting sedatives, if you take them the night before to help you sleep, that drowsiness can persist into the next day. So when you're getting up, you might still feel a bit drowsy. So it's important that you only take them when you need them, and that you get them reviewed regularly to make sure that they're still right for you. There are some antidepressants that are associated with a higher risk of falls. The most commonly prescribed groups are the tricyclic antidepressants and the serotonin and noradrenaline reuptake inhibitors. So with the tricyclic antidepressants, that would be a medicine such as amitriptyline or nortriptyline. There's also dosulapine that we don't see prescribed very often now. They can also be prescribed for other indications such as neuropathic pain, so that's pain that involves the nerves, and also to help people sleep. They are sometimes used. And again, it's just important to make sure that they're still effective and that you still need them. With the SNRIs, or serotonin and noradrenaline reuptake inhibitors, the more commonly used medicines in that class are venlafaxine and duloxetine. And then the final antidepressants that can increase the risk of falls is the monoamine oxidase inhibitors. They are not used as commonly now, but they can be still prescribed for some people with difficult to treat depression. The next group of medicines associated with a high risk of falls are the drugs used for psychosis and agitation. So these are antipsychotics such as olanzapine and risperidone and quetiapine. And again, these are very effective medicines, and depending on what you use them for, they might be needed for in the longer term. But it's also important to keep reviewing, because people's conditions change as we age, and it's important that we're still on the right dose and the right medication. There's also painkillers, so particularly opiate painkillers that can cause drowsiness, and again, they can increase the risk of falls. So common medicines in this group would be, for example, morphine, codeine, and tramadol. And again, it's important to make sure that you take your painkillers if you need them. But if your pain starts to get better, or you feel like you can do so without some of your painkillers on some days, then think about whether you still need them, and also try and get them reviewed regularly to make sure that they're still the best painkillers available for you. And then there's also anti-epilepsy medication and Parkinson's medicines that tend to be taken for the long term, but can increase the risk of falls as well. So here I've summarised the medicines that affect your heart and circulation that are associated with a higher risk of falls, and they are also coded red. So the first group are beta blockers. So this would include atenolol, propranolol, and bisoprolol. They are usually used to lower blood pressure and slow down your heart, or sometimes propranolol might be used for anxiety as well. The next group mentioned a GTN, so glyceryl trinitrate, and they usually come as a spray or sometimes as sublingual tablets. And you would use these when you're experiencing symptoms of angina, just to relieve those symptoms. And it's really important to be aware that just after you've used your spray or your tablets, you might be at a higher risk of falls. The next group are nitrates. So this would be isosorbide mononitrate or isosorbide dinitrate, and they're used to prevent the symptoms of angina, as is nicorandil. The next group are ACE inhibitors or angiotensin converting enzyme inhibitors, and examples of these would be lisinopril or ramipril, and they are also used to lower blood pressure. And the next group of thiazide diuretics, such as bendroflumethiazide, and they can also be used to lower blood pressure, and sometimes if you are carrying too much fluid, then they can be used to reduce the amount of fluid that you've got. Next is alpha receptor blockers. So this would be doxazosin, prazosin, tamsulosin or alfuzosin. They are used for high blood pressure or for prostate problems in men. So the next question is, what can we do if we're prescribed medicines that are associated with an increased risk of falls? I think it's important to never stop taking your medicines suddenly, but instead ask for your medicines to be reviewed regularly to make sure that they are still right for you. Try to understand your medicines and what they are for. And if you think that one of your medicines is making you sleepy or confused or causing you to feel dizzy, talk to your doctor, pharmacist, or nurse about stopping that medicine or just reviewing it to make sure that it is still the right medicine for you. And then I'm moving on to talk about bone health. So for healthy muscles and bones, it's important to know that you need calcium, vitamin D, and protein. So calcium keeps our bones and teeth healthy. Vitamin D helps our bodies to absorb the calcium. And protein is important for muscle maintenance. If your diet isn't as good as it should be, or you're struggling to take in the recommended daily amount of vitamin D and calcium, you may want to consider taking a dietary supplement. Go for one that contains calcium and vitamin D. Your GP or pharmacist can help you to choose one that's suitable for you. All adults are advised to consider taking a daily vitamin D supplement, particularly during the winter months from October to March. And people who are not often exposed to the sun should take a daily vitamin D supplement through the year. So if you don't go out very often in the sunshine or wear short sleeves while you are out, it might be worth thinking about taking daily vitamin D through the whole year. There are some foods that contain vitamin D. These include oily fish, such as mackerel and salmon, eggs, foods fortified with vitamin D, such as fat spreads and some breakfast cereals. But it's really difficult to get enough vitamin D from food alone. And the main source of vitamin D for lots of people is sunshine. Osteoporosis causes bones to become weak and brittle, and it can cause your bones to be so brittle that a small fall or even mild stresses, such as bending over or coughing, can cause a fracture. So it's really important to do everything we can to prevent osteoporosis from happening in the first place. There are many things that have increased the risk of people developing osteoporosis. There's the risks that we can't change, so they're called the unchangeable risks, and that would be factors such as your age. As you age and get older, your risk of developing osteoporosis becomes greater, and also your gender. But there are a lot of other factors that we can change, and it's important that we do what we can to prevent you developing osteoporosis. So the first risk mentioned is hormone levels. So low hormone levels in women can increase the risk of osteoporosis. There's your diet and making sure that you're taking enough vitamin D and calcium. There's steroids and some other medicines that can increase your risk of osteoporosis, and it's important that your medicines are reviewed regularly to make sure that they're still right for you. There's lifestyle choices such as maintaining a healthy weight, smoking and alcohol intake. These can all increase your risk of developing osteoporosis. And finally, there's some medical conditions that are associated with an increased risk of osteoporosis if they're not well managed. So the treatment for osteoporosis is often based on an estimate of your risk of breaking a bone in the next 10 years using information such as the bone density test. So if your risk isn't high, treatment might not include medication and might focus instead on modifying risk factors for bone loss and falls. So for the treatment of osteoporosis, most widely prescribed medication is biphosphonates. I've named a few here. So they're alendronate, ibandronate, bizedronate, and zoledronic acid. The most common side effects that people find with taking biphosphonates are nausea, abdominal pain, and heartburn-like symptoms. They can be minimized by following the instructions of taking in the morning with a full glass of water, not tea or anything containing milk, at least 30 minutes before your first food or other oral medication. And it's important to stay upright, so sitting down or standing up for at least 30 minutes after taking them. I know it's tempting to take them and then go back to bed for half an hour, but it's really important to stay upright for that 30 minutes after taking them. There are some very rare side effects that are also associated with biphosphonates. So if you experience any thigh, hip, or groin pain, it's important that you report them to the prescriber or your GP. It's important to take good care of your teeth with regular dental checkups. And if you have any ear pain or discharge from the ear or an ear infection, it's important to let the clinician know that you take biphosphonates when you get it reviewed. It's also important to report any difficulty or pain once swallowing, new or worsening heartburn or pain inside your chest. But these symptoms can be minimized by making sure that you follow the instructions of staying upright for 30 minutes and taking them with water before your first food or other oral medication. And biphosphonates are usually reviewed every 5 years to make sure that they're still the right medicines for you. HRT is generally used in younger postmenopausal women. So when you reach the menopause, estrogen levels decrease, which causes many women to develop symptoms such as hot flushes and sweats. The decrease in estrogen levels also cause bone loss, and the menopause is an important cause of osteoporosis. So it's important where it's been identified that you might benefit from taking HRT or hormone replacement therapy for your menopause and for the prevention of osteoporosis, because it's replacing the low levels of estrogen that you have. So thank you for listening to this presentation. I hope it's been really useful for you in understanding which medicines can increase your risk of falls and what you can do to minimize that risk, and also to think about osteoporosis and what we can do to reduce the risk of developing osteoporosis, as well as trying to understand some of the treatments that are used to treat osteoporosis once it's developed.